what are you hoping to collect during the study? Is it safety, the effectiveness? Is it reactions that people have, whether or not people that were exposed are not seroconverting or testing positive? What are you hoping to collect? What kind of data?
So the way our study is designed is that we ask participants to take a daily pill, and this pill will actually be either Truvada or actually a placebo, which is sort of a dummy pill.
Right.
And it's double-blinded, so neither the researchers nor the participants know what they're taking.
So the person that's participating in the study doesn't know what they're getting.
Exactly.
The people that come in with a cup with a pill don't even know if it's the real thing or not.
That's
and
correct.
How long? This sounds like a really strong dedication. Anyone participating, how long do they have to actually commit to this?
So you're absolutely right, and the volunteers who participate in our studies are very dedicated, and we're incredibly thankful for their participation. This particular study has a variable amount of time that people are in the study, and it has to do with how long the study takes to fully enroll. But the study will probably end sometime in 2010. So it'll be about
2 years.
Yes.
Okay. That doesn't sound like much, considering the impact that HIV has had.
Yeah, it can go by quite quickly.
And it's not like you're seeing everyone every week.
No, what we do, this study involves coming in every month to our clinic to see our staff. And what we do is we provide people with we do rapid HIV testing as well as counseling.
Is that like a swab in the cheek? Or?
It's actually a blood draw, but
Okay.
we also draw other blood to monitor people's health to make sure that they remain healthy in the study.
Right.
And we also provide free STD testing as part of the trial. And then we provide people additional pills as when they come in for their visits. And one of the things that people say that's been really helpful in participating is that they've really formed relationships with our staff. We have a really great staff of counselors and clinicians, and you get to see the same people and build a relationship over time. And it's very rewarding for people.
I'll vouch for that. I'm actually in a study for the HIV vaccine.
Wonderful.
So until I'm out of that, I'm not going to be able to qualify for the study for Prepare. But I just want to share that it's easy. It's a breeze. Participating in a study, staff is great. They know what they're talking about. They listen. Everyone's interested in every aspect of how this affects your life, including who you tell, who you don't tell. It's an awful lot of clinical research. I mean, this is a big, big lab. There's a lot of blood draw. How much would it cost someone to participate?
So there's actually no cost to people to participate. In fact,
Say that again.
There's no cost.
There's no cost
for people to participate. And in fact, we do reimburse people a small amount, about $50 per visit, to be part of the studies, because we appreciate that we're asking people to give their time and also to cover some transportation costs to get to the clinic.
And it's amazing how, if I do tell someone that I'm in a study, that I get people saying, "Thank you so much." I mean, that's a big help. And I'm thinking, you're just like taking a couple of vials of blood like every couple of months. And it's easy. It's a breeze. But the big thing is all this data. It's the information is helping towards the advancement for treatment. And maybe someday a cure?
Well, so the data that we're collecting is very important. And ultimately, we'll see whether a daily pill could prevent people from getting HIV. This isn't a cure, and this particular strategy is geared for people who are HIV negative, and our goal is to try to prevent them from getting infected.
Which also means keeping people negative.
Exactly.
Right. And yeah, the word cure, I've had people talk about this over and over. It's like, I'm in a vaccine study. It's a vaccine study. So they found the cure. Not a cure. A cure is more like you eliminate the disease. You eliminate the virus.
Yeah, so I mean, typically in medicine, a cure, like if you had a strep throat or something and took antibiotics,
It's gone.
and it's gone. Unfortunately, with HIV, it is a chronic infection, and science hasn't figured out a way to eliminate the virus from the body.
Right.
But fortunately, we have really effective and safe medications for HIV treatment. And our hope is that some of these medicines could also help prevent people from getting infected.
Okay. Albert, please tell me, why start? You have a back. You used to be at Haight-Ashbury
Uh-huh.
Clinic. You're currently with SF General Hospital.
Uh-huh.
You're still studying the effects of Truvada as a prophylaxis.
Uh-huh.
Why start all this?
Why do this research?
Yes.
So there are many reasons. Personally, as a physician, I've taken care of a lot of HIV positive patients in my training as well as when I was working at Haight-Ashbury. And I just personally experienced the profound effect that HIV can have on people. Also, as a member of the gay community, I feel very devoted to this issue and as it has really affected so many people. But sort of thinking more broadly, we know in San Francisco there are 15 to 20 new HIV infections per week. And in the U.S., their recent statistics show that there are over 56,000 new infections per year. So we clearly need new ways to prevent infections. And we know that no one size fits all. So,
Right.
some strategies may work for some people and different strategies work for others. And so we need a toolbox of prevention strategies. And PrEP is really a promising strategy that we hope can be added to that, our prevention.
Okay. What about safety? Because it's a study on a drug that could prevent HIV infection. Have you ever had the argument, why not just test it on lab animals, or why not just test it in a petri dish? Why test it on humans? What would be your answer?
So safety is a really important thing to be studying, and that is actually a part of all of the PrEP trials that are going on to study the effects of the medication on people who are HIV negative. This medication has been tested in animal studies for both safety as well as efficacy, or how effective it is.
Right.
And has been shown to be safe and effective in animals, as well as many clinical trials of humans. Most of those studies have been in HIV positive people because this medication has been licensed for treatment.
Okay.
So we do have a lot of safety information already about the drug, and that's one of the reasons why we chose this drug, is because of its favorable safety profile.
Okay, so side effects are pretty much on the safe side.
Yeah, the majority of people who take this medication have few or minimal side effects, and the people who do have them, generally they're mild, and they may get better as people take the medication.
Okay.
But that is something we are following very closely in this study, and that's partly why we have the frequent visits to monitor people's health and to make sure they stay healthy.
I remembered when I started the study for the vaccine early on, I just caught a simple cold. And when I just told my clinician, oh, yeah, I know I got an appointment next week. By the way, I got a little bit of a cold. And they're like, what's your temperature? What are your symptoms? Do you have a runny nose? Are you coughing? I'm like, it's a cold. And they just wanted all the information. They wanted me to take my temperature. And I thought, it's just a simple cold. But I realized that for the study, they want all those details.
We do collect a lot of details in
Right.
this study, and we do. I mean, we take it very seriously, and so we do monitor people and their health, and so
Staff is great.
yeah.
The staff is fantastic. For anybody that wants to participate in the study, can they contact you through the website? Should they go to 25 Van Ness? How does one get information about this?
Yeah, so there's two main ways that one can get information. First, like you said, visiting our website, which is www.preparesf.org.
Yes.
And there's a lot of information about the study on our website. We also have a Prepare hotline, and people can call in. The number is 415-554-8888. And they can call in and talk with one of our staff members. We have really great staff, and they can provide more information about the study. And if people are still interested, then we schedule them for a time to come in where we can give more information.
Fantastic. We're almost out of time, so again, we want to remind people, if you're a man who has sex with other men, or if you're at high risk, please contact preparesf.org about the Prepare study for staying negative, helping out the community. I want to thank my guest, Dr. Albert Liu. This has been SF Live. I'm Renal Valley. We'll be back next time. Thanks for watching.